Hi, I'm Bob Zemke with Extreme Networks, and today I'm bringing to you remote network connectivity options, 5 things to consider. The rapid escalation of COVID-19 patient cases has created new challenges for healthcare organizations, both in terms of scaling up testing and care, while at the same time reducing the risk to non-critical patients and care workers in the facilities. We should start with assessing the requirements to the organization. Hospital IT organizations around the world responding to the growing challenges of this crisis. The scope of the pandemic has created a situation where regional healthcare providers are unable to shift patients between facilities to balance support needs. And now facilities, many locations are having to become more creative in the use of space available. It's creating a unique situation in that patient care and hospital operations are being forced to operate outside of the traditional walls of the hospital. For many organizations, teleworking and remote care models have just gone from a theoretical exercise to being immediately implemented. IT departments are being asked to evaluate and provide rapid and secure infrastructure solutions for 3 operational models: teleworkers, on-site outdoor setups, and remote temporary facilities. It's important to assess the organizational needs, starting with the teleworker. In addition to closed schools and stay-at-home orders, many organizations are looking to reduce exposure from person-to-person contact and to prevent hospitals from being overrun. One of the first considerations is how can employees switch to working from home with the necessary communication and connectivity requirements to do their job. Different employee roles require access to different systems. While some employees can function with possibly just a cell phone and a laptop, contact center agents or medical staff may require additional systems at their home. Access points and branch routers designed to plug in and securely tunnel traffic back to the hospitals are a means to deliver secure and seamless connectivity for these newly virtual employees. Another setup requirement is for outdoor solutions. Emergency departments, outpatient facilities, and other first stop departments are challenged with limited space and the risk of additional exposure points in tight areas. Phase 1 is typically the rollout of testing tents next to hospital entrances. In parts of the US, there's even included drive-through testing services. Phase 2 is for regions experiencing a greater number of exposures, and the priority shifts from testing services to initial triage and care. These required wired and wireless connectivity into tents to provide everything from medical device connectivity to guest Wi-Fi services. Depending on the current wireless coverage outside of the hospital, it may be possible to just quickly patch a few additional access points near these tents and wire it back to the hospital for coverage. But for larger setups, a point-to-point bridge is necessary to deliver connectivity from the buildings into the tents and provide enough bandwidth. Companies such as Extreme Networks offer cloud-based kits, rapid outdoor connectivity kits for simple, quick setups in these types of environments. And then remote temporary facilities. A number of healthcare organizations and city municipal governments and national health systems are turning to other locations, such as hotels, dorms, schools, and convention centers, to provide additional care facilities in given cities. These locations may or may not have internet connectivity for supporting care operations. In situations such as this, a cloud-based branch router can quickly be set up to create remote extensions of the hospital network. For locations that lack existing internet connectivity, branch units can often support cellular adapters either via USB or Ethernet. The downside is that bandwidth may be noticeably slower for hospital applications, as well as expensive if scaled out across a large number of sites requiring cellular connectivity. Tip number 2 is to check your equipment inventories. Now that you've identified what are the intended operational plans, the next step is to investigate what equipment you have on hand. Most organizations have little in the way of additional equipment stocks, and supplier inventories are quickly being depleted. Work with your suppliers and vendors now to try to prioritize acquisition of additional equipment as quickly as possible. Based on availability, consider alternative solutions to get your organization through the current crisis, and don't let staff preferences become a delaying factor. It's important to understand and focus on what is needed for the organization now versus what we would like to have in a perfect world and at a later date. Tip number 3 is staffing. Just like the caregivers working long hours and at risk, so are the IT staff in organizations supporting care. Create plans to limit exposure, balance staff workloads, and assess skill sets. All non-essential IT projects and activities should be suspended so that resources are available to focus on the current situation. Also, departmental scenarios outlined above may be new concepts for your staff where they're trying to troubleshoot and build on the fly. So leverage partners and vendor expertise so your support teams can be expanded and to prevent wasted efforts with a team trying to possibly reinvent the wheel while designing architectures they've never used before. And lastly, watch out for staff burnout. Just like everyone else at this stressful, trying time, it's very easy for people to feel overwhelmed and burdened and for mistakes to be made. Tip number 4 is to communicate IT's capabilities. At times like these, assumptions made by groups can be very different than reality. We've seen a number of situations arise where the larger organization assumes equipment is readily available, that staff are prepared, or that even solutions have been tested or tested to scale. It's critical to communicate to hospital leadership the IT department's current capabilities and what the challenges are ahead so that problems can be proactively solved and risks reduced. During a past hospital crisis I was personally involved with, we had a motto that bad news needs to fly faster to up the organization than good news. The quicker we could provide information to the organization, the better they could respond accordingly. And tip number 5 is to coordinate with the command center. It's critical for IT to be a part of the hospital's command center so that work can be prioritized, issues communicated quickly, and delivering IT services as efficiently as possible. Unfortunately, in situations like this, it's not a sprint, but it's a marathon. And organizational requirements from IT will continue to shift as situations change. Command center operations are an established process to effectively disseminate large volumes of information coming in from the field and setting priorities among various teams. Be sure to have a clear communication structure in place for IT to communicate up, as well as for information to flow downward. In summary, healthcare IT organizations are being asked to quickly design and deliver solutions for new operational models that may or may never have been thought of in prior planning to this event. We have a long road ahead in support of our healthcare organizations. Good luck and let us know if we can be of help.